It's one of the most common cancers affecting Canadian men, generally 40 years of age and older. In fact, 1 in 7 are at risk of developing prostate cancer in their lifetime. What people may not realize is that approximately 10 to 20% of prostate cancer cases present as the most advanced stage of the disease, and another 33% with early-stage disease go on to develop metastatic disease. Stuart Campbell was diagnosed with prostate cancer 6 years ago, which has since progressed to metastatic disease.
This is a high-stakes game that I'm in, and I've accepted that there's not a cure yet, but you can sure extend this elastic band an awful long ways before it breaks.
Metastatic castration-resistant prostate cancer, or mCRPC, is a devastating disease for both the patient and their family and friends, and affects approximately 300,000 men every year, our fathers, grandfathers, brothers, uncles. Unfortunately, the disease is ultimately fatal. Dr. Fred Saad, professor and chief of urology at the University of Montreal Hospital Centre, discusses the challenges of treating this advanced stage of the disease.
The challenges in treating metastatic castration-resistant prostate cancer are multiple. First, we're dealing with patients that are older, that are more fragile, have a lot of other health-related issues, and we're dealing with a stage of the disease that leads to a lot of morbidity, a lot of suffering, because it usually affects the bones. Patients can go through fractures, can end up becoming paralyzed, and it always leads to, unfortunately, the death of the patient. So we're constantly looking for treatment alternatives that will prolong patients' lives, improve their quality of life, and reduce their suffering. So it's a real challenge.
Health Canada has approved Xtandi, or enzalutamide, an androgen receptor inhibitor that acts on several steps in the androgen receptor signaling pathway. It works by blocking the activity of androgens like testosterone, thereby slowing or stopping the growth of prostate cancer, which may result in tumor shrinkage. Xtandi is approved for the treatment of patients with mCRPC who have received prior docetaxel therapy, a chemotherapy medication.
New therapies such as Xtandi are very welcome for us treating this patient population with very advanced prostate cancer in the castration-resistant state, since the treatment options we have are effective but very limited. And we can't always use them in every patient. So having options that are very well tolerated, that prolong patients' survival and improve their quality of life are really very much welcome in this field.
So I said I had a lot of time. I'm a young man, and I had confidence in science coming forward to bring some possibility of solutions.
Patients with castration-resistant prostate cancer and their treatment teams face many challenges, as approximately 90% of these men will develop bone metastases, causing significant morbidities such as pain, pathologic fractures, spinal cord compression, and bone marrow failure. As treatment of mCRPC requires a multidisciplinary approach, it's important that patients consult with their health team to determine an appropriate treatment strategy.